Today, I am talking about the 7 types of eczema and how to address the root causes of each type so that we can really get lasting relief from this condition. Now, this is a very complex topic because I'm going to break it down. I'm going to try to break it down rather simply, but sometimes it's not as simple as just compartmentalizing all the different types of eczema and then talking about how to address each and every individual type of eczema because it's a little more complex. Sometimes people can have multiple types of eczema at the same time. And then there's a lot of overlap in terms of the root causes, but I'm going to try to make it simple. If you identify with some of these types of eczema, then we'll talk about some of the root causes that you might want to start thinking about if you are seeing that the presentation of your skin looks like some of these pictures. Okay. So we are going for 15 minutes. We're going to talk about the 7 types of eczema and how you can address the root causes of each. Then I'm going to have a live Q&A. You guys can ask me anything throughout this part where I'm just kind of talking about all of the root causes and the types. Please go ahead and type into the comments, type into the chats, ask me questions, and then I'll go back at the end and I'll answer all of those, okay? So we are going to start with the first type of eczema, which is the most common type, and it is called atopic dermatitis. And this is a type of eczema that often starts in childhood. So if you have a little one with eczema, this is a very common type of eczema. It can often be linked to some genetic issues like having something called a filaggrin mutation. Filaggrin is something that really helps our skin barrier to be really strong. So when people have this mutation in their genes, they can often experience very dry and infection-prone skin, and this leaves them more susceptible to having atopic dermatitis. So our Cleanbody solution, how do we get to the root cause? Well, with all types of eczema, we always want to begin by healing the gut, and especially in atopic dermatitis, because the gut and the skin have a very close connection. And we notice that when the gut is inflamed and when there's something called leaky gut, we can see that someone might be more predisposed to having leaky skin. So by healing the gut, we are in effect healing the skin. And we also have seen that there is a correlation with the gut skin microbiome. So if we support that gut and we heal the gut microbiome, we are also going to heal that skin microbiome. And that skin microbiome does support a stronger skin barrier. Clean food, as we're talking about all week, last week, is really important to strengthen the skin barrier from within. So really good fatty acids like omega-3s are really important. A lot of those phytonutrients and colors in your food really help to give your skin what it needs to make sure that barrier is really strong. All right, my pro tip is use a really good skin barrier ointment. Unfortunately, a lot of them out there have things that we might be allergic to or sensitive to, things like soy, coconut, and then there might be some toxic things in those ointments like petroleum and mineral oil. So at Cleanbody, we have an ointment called Clean Skin Protect, and this is an option. It has things like emu oil, castor oil, jojoba oil, shea butter, and cocoa butter, and it can really help to seal in that skin barrier when someone is more predisposed to having that leaky skin. You may want to think, if you have atopic dermatitis, of making sure that there's more moisture in the air. So using a humidifier to increase the moisture in the air. And then, as we mentioned, we always want to start with healing the gut. So I like to call it, and actually in naturopathic medicine, we like to call it a 4R gut healing protocol. So it's not just important to take probiotics, but we actually really need to do 4 things when we're healing the gut. We need to rid the gut of anything that is causing inflammation, anything that's causing a problem in the gut. That could be things like sugar and even food sensitivities, food allergies, toxic foods like pesticides and GMO foods as well. The second R is we need to replace. So let's say your body is not making things like bile acids correctly or digestive enzymes, we might need to give you those while we are trying to heal the gut. The third R is repair. So with that leaky gut, we're going to see that the cells of the gut might get leaky and you're having a lot of leakage into the system. Now, I actually recently heard a really good analogy about this when I was on a podcast. Um, I want you to think of leaky gut being like the TSA check in the security when you're going to the airport. That TSA check is really making sure that, you know, dangerous things like guns and bombs aren't getting through that security gate. And this is the same thing that we are doing in our guts. Our gut has that TSA check, and it doesn't allow things to get into our system that might actually cause inflammation in our systems. And when we have leaky gut, unfortunately, that TSA check is not working well. And now you're actually leaking in things that you shouldn't be leaking in. And this can lead to inflammation in the body overall. This also happens on the skin when you have that predisposition for having that filaggrin mutation. And also when there are other damages on the skin, when you are doing other things to damage the skin, you can then have that leaky skin. So we have to restore. That is the third R there. The fourth R is we do need to make sure we replenish. So we need to replenish the bacteria that might not be there that's beneficial. Okay. So if you have atopic dermatitis, the gut is really important. The skin barrier is very important. All right. Moving on to our second type of eczema, it's contact dermatitis. And just like it's depicted here, oftentimes it's from something that we're touching that is actually causing a reaction. And it doesn't typically run in families or necessarily linked to conditions like asthma, but it is very common among professionals who handle a lot of chemicals. So, what this can suggest is that contact dermatitis may stem from toxic burden. So, the Cleanbody solution to getting to the root cause of contact dermatitis is we have to identify and then eliminate any toxic exposures. We have to support those detoxification pathways. And that is how we may address contact dermatitis. My pro tip is to make sure you're using clean products. Make sure you are using all clean products in your home for cleaning supplies, on your skin. Make sure you're filtering your air, you're filtering your water. Those are all potential toxins that we could get exposed to that could then fill what I like to call our funnel, and then everything overflows, and then we end up with contact dermatitis. You want to make sure to do a patch test on any new products. Make sure you're staying away from things like nickel, fake jewelry, etc. And then we want to make sure to support that liver. And, I think it's important to work with a practitioner when you're doing this, but we do also have a product at Cleanbody called Bile Essentials. And that is kind of a general, very simple supportive supplement that has a bunch of herbs and nutrients that will support the liver to create bile and to help with the process of detoxification. Okay. So that is contact dermatitis. Now let's move on to dyshydrotic eczema. Dyshydrotic eczema is where you're going to see these little bubbles on the skin. Oftentimes, just like depicted here, you'll see it on the hands. It's a really common place. They might be itchy and they really look like blisters, like fluid-filled blisters. You'll see them on the palms, the soles, the edge of the fingers and the toes. And we don't exactly understand the cause of this, but we do know that it runs in families. It's more common in women. So there's potentially a genetic component. But I have really seen the trigger to be stress. That's a really big one that I have seen. And in my practice, I have a really good story of a patient who we did everything from stress relief to changing the diet to detoxification, and the dyshydrotic eczema on her hands got completely better, and it was really, really severe. And then nothing changed except the stressful trigger came back into her life, and it all came back. And so to me, a stress, I think, is a really big, trigger of dyshydrotic eczema. And every time I have seen a case of dyshydrotic eczema and I kind of dig a little bit deeper into the case, I often do find that stress is playing a role. There could be traumas from the past, there could be stressors that are current, but it is almost always there. So it's something to really think about. However, there are also other triggers, things like our exposures as well, nickel, seasonal allergies, very humid weather. If you're sweating a lot, often that will trigger this too. If you have a job where you do a lot with washing your hands, like hairstyling or a healthcare job where you're just washing your hands all the time, this can trigger that dyshydrotic eczema as well too. So for me, the clean body solution, I often see one of the biggest ones is we have to regulate stress and support the immune system. We have to do things like make sure you're hydrated, make sure you're sleeping well. Maybe you're reducing caffeine. That could also be affecting your hormones. You want to make sure to use nickel-free products. And my pro tip is to really try out the 4-7-8 breath. If you find yourself in a very stressful situation and you're someone who has dyshydrotic eczema, I really need you to pull yourself out of that stressful situation and using tools. And one of my favorite tools is just a very simple 4-7-8 breath. You're breathing in for 4, you're holding that breath for 7, you're releasing that breath for 8. And so I think this can be really, really helpful in this situation, but we often have to dive deeper. Why are you getting triggered so much? Why are you getting triggered all the time? And often we don't even know we're in a stressful state, but we potentially are. And so those are things that, we want to uncover. All right, nummular eczema is basically, as you see in this picture here, it's coin-shaped eczema. And it can be scattered all over the body, and they can be itchy, they can be oozing. It is more common in males, and sometimes this is triggered by insect bites. Also, if the skin is just very dry, or if there's been trauma to certain areas of the skin, we might see this nummular eczema. We want to make sure that we're drinking a lot of water, really hydrating internally, and then even potentially externally, making sure, again, that barrier of the skin is really good. Here's another time we might think about Clean Skin Protect, making sure we're putting a good barrier on the skin. We may also want to think about other triggers, like, is there something you're eating? Are there food allergies, food sensitivities? And then, of course, that leads us to think about, is the gut implicated here? And do we need to think about if there's gut inflammation and leaky gut as well? You want to think about making sure to use those clean, fragrance-free, hypoallergenic products so that you're just not irritating the skin more, because that trauma to the skin can often cause this type of eczema. All right, moving on to seborrheic dermatitis. And as you see depicted here, seborrheic dermatitis can often occur on the scalp. You can often see this show up as dandruff, rashes, itching, and then just a lot of kind of flakiness. And it also not only comes on the scalp, but other places where there's a lot of oil producing glands. So your upper back, your nose, sometimes people have it on the eyebrows, or males often have it on their beard or their mustache areas. And this can be due to a growth of a yeast called Malassezia. And it can also be in infants. You might see this as cradle cap in infants. And for adults, it can continue on. So often in infants, it usually clears up. In adults, it can be something that continues, and it can really kind of flare when you're very stressed out. So that's something to think about. Here is stress too. As I mentioned, there's a lot of layers here, and it's not as simple as, really compartmentalizing each type, because often there is a lot of kind of interplay between these types and also the root causes. So the Clean Body solution is to restore balance to the skin and gut microbiome again. And this is especially important because we know that seborrheic dermatitis can really be due to that overgrowth of that specific type of yeast. And so same things that we discussed before, the 4R program to heal the gut, using things like topical probiotics can be really important. So we have a product called Clean Skin Restore, which is a topical probiotic, and you can spray that on the skin, and that will potentially help to promote the good bacteria on the skin and really limit that overgrowth of malassezia on the skin. And then food wise, we want to make sure that we're reducing sugar and processed foods. These can feed yeast in the body, in the gut, and that can cause the malassezia on the skin to proliferate more. And then you may want to think about natural antifungal remedies, things like tea tree oil, grapefruit seed extract. These are things that, if I'm working with someone with seborrheic dermatitis, I'm going to kind of pick and choose depending on what their sensitivity levels are, how old they are, et cetera, in terms of what I might use topically and internally. All right, number 6, and we have 2 more left. Stasititis. This, as depicted here, you often can see this in the lower extremities because it's due to poor circulation. You will see here swelling, itching, and skin irritation. It's often associated with aging, but it can also be associated with people who have heart or kidney disease because that circulation is going to be compromised. You might see it if someone has varicose veins, high blood pressure, if there are multiple pregnancies, and if you just are someone who sits or stands for a prolonged period of time, you might be more prone to this type of eczema. The Cleanbody solution is light exercise. Move your body every single day. Don't find yourself sitting at your desk all day long and not getting up and moving around. If you're on an airplane, get up and move around at least once an hour, especially if you are on a plane for a long period of time. You can eat foods that improve circulation, things like cayenne pepper and turmeric, and you want to strengthen the vein health, and we can do this with certain supplements. Of course, you want to make sure to work with someone to find the best supplement for you, but things like horse chestnut extract can be really helpful. And then my pro tip is to elevate your legs for 15 minutes a day. Just, lie on your bed and stick your legs up on the wall. Even better if you can do a little bit of lymphatic drainage massage. So just think about just pumping the lymphatic system down, especially if you have this on your feet. Using compression socks can also be helpful here. And finally, we have neurodermatitis. And with neurodermatitis, this is really an intense itching that leads to constant scratching. And then you end up scratching like 1 or 2 areas of the body, and it's only in 1 or 2 areas of the body. And that's how this is a little bit different from atopic dermatitis, which you can see in multiple areas of the body, all over the body. Neurodermatitis is often confined to just 1 or 2 areas. And then you might, because you're just constantly scratching that one area, you might get these thick, leathery patches of skin. It's called lichenification. And the problem is that there's kind of a reward that happens here when you scratch. It activates your brain's reward center, and it just kind of continues the cycle of itching. Now, again, this can happen in the other types of eczema too, but when someone has this type of eczema, it's typically only in one area. We want to focus here on stress management, okay? Because oftentimes we're doing this sometimes as a tick, sometimes as something that just kind of feels good, and sometimes it is triggered by anxiety or stress. We want to make sure to improve sleep hygiene, reduce stimulants, because that can actually affect your hormones and cause more stress, okay? So Clean Skin Calm might be a nice option because that actually calms the inflammation on the skin. We want to do the 4-7-8 breath here as well too. This might calm the system. I also really like the large intestine 11 point. It's right here on the elbow. You can massage it here, and that can sometimes help to lower that itchiness or that urge to scratch. Adaptogenic and calming herbs, these are things that can help lower that stress response. And then maybe you want to wear some gloves at night just to make sure that, you might be unconsciously scratching. Maybe you are actually stressing at night in the middle of the night. And if you wear those gloves, sometimes that can be helpful. So you can go to my product recommendations. The link is in my bio. And under Skin and Beauty, you can kind of go down, and there's some eczema products there. And there are a couple of products we have where you can actually just put gloves on, or actually like your whole entire upper body. Okay. All right. So we went through the 7 types of eczema. how to address the root causes of each. But I do want to say it is not that simple. Oftentimes, there's a lot of overlap here. And oftentimes, people have multiple types of eczema all at the same time. The more severe you are, the more types of eczema you can actually have together. And when it comes down to it, we really just want to see the body as a whole organism. And we want to just assess all the different organs and understand what's imbalanced. But when you have a specific type of eczema, there it might kind of suggest that we might focus on a specific organ or a specific area more than another. But no matter what, when I'm working with a patient, I'm also always assessing all of the organs, no matter what type of eczema they have. Okay. So it can be important to just kind of assess everything. All right. Well, that took me a little bit longer because it's a lot of information, but I would love to now open it up to questions. Remember that this is for informational and educational purposes only. This is not medical advice. It does not create a doctor-patient relationship. But if you do want to create that with me, then there's lots of ways to do that. You can definitely start by taking my free eczema assessment, coming to my free live workshop, and we can meet and we can kind of understand, how we can work together. Or if you're ready to just talk to me individually, you can also book a consultation. All the links for that are in my bio. And I would love to now open it up to some questions. So if you guys want to type into the chat or the comments box here, I covered a lot of ground today, and I would love to answer any questions you have about any of these different types of eczema, because there are a lot of types here, and we are really trying to understand how do we get down to the root cause of each and every one of these types. Okay. So if you guys want to type into the comments or the chat, I'm happy to answer any of your questions here. And sometimes we don't even know that we have a specific type of eczema. We've just been calling it eczema this whole time. And it can actually be interesting to understand the specific type of eczema that you have, because again, that could help us understand where we might need to look. For example, if you mostly have it on your scalp, we might want to think about seborrheic dermatitis. Okay. If it looks like the coin shaped, then we'll want to think about nummular eczema and the reasons behind that. Okay. So those are all things that we want to think about. And it just kind of helps us, I feel like treating eczema and healing eczema, it's about understanding the puzzle pieces. And that often doesn't happen in conventional medicine. But because mostly we're given a medication to just kind of silence the symptoms. But if we are truly going to heal eczema, we want to figure out what those puzzle pieces are and start putting them together. All right, so my daughter's first symptom looked like a heat rash. Now she gets small, itchy, pimple-like spots. She doesn't have dry skin. What type of eczema would this be? Okay, it's a little hard to really understand it without seeing a picture. I might invite you first off to do my free live workshop. Go to my link in my bio and click there, because when you do my live workshop, you will actually get access to my journaling system. You can then put a bunch of pictures into the journaling system, and then you can volunteer for me to look at those at the workshop. And then I will make those anonymous, and then I can kind of assess that. But right off the bat, I would say that this may fall into the category of atopic dermatitis, which is more widespread over the body. It's possible that this could be hives. I would have to see a picture to kind of know for sure. I don't know if those little bumps come up and then they go away. If it started out like a heat rash, oftentimes I like to think about liver gallbladder as one of the things to think about. I like to think, okay, is that liver gallbladder full? And I like to think of it as a funnel. Is it overflowing? And so when the body gets heated up, then are those toxins trying to release through the skin because they're not able to go out the other directions? And the other directions are poop and pee. And so if your daughter might not be pooping well. Maybe she's constipated. We also might want to think about gut. So this is kind of how we unravel that picture. Seeing the actual skin pictures can be really helpful. The other thing that helps me here is seeing the pictures of poop. That can be helpful. I know it's a little weird, but I often ask people to take pictures of their poop in their journals as well. If I see very constipated poop, if I see very light colored poop or clay colored poop, that can indicate that the body's not creating enough bile, and bile is what helps toxins get out of the body. And so that can really, kind of help me out to understand even more. So I'm kind of put more of those puzzle pieces together. And yes, okay, so she was dealing with constipation when she had her first reaction. Okay, so there you go. Constipation is really not allowing the toxins to exit the body. So in the most simple way, I want you to think, if those toxins aren't exiting the body via poop, they're going to try to exit via the skin. As they are exiting via the skin, they can also stimulate an inflammatory reaction that happens that can create that heat rash like reaction. Okay. Okay. Thanks for all the info. Does unexplained hives that come and go considered eczema? No. So that's not actually considered eczema. It's another diagnosis. It's called urticaria. So it's hives basically. And it's not considered eczema. Eczema is more when you actually, most of the time you kind of see the inflammatory reaction on the skin, and hives usually come and go. Like, maybe you're eating a food, maybe you're stressed out, maybe you go out in the sun, and then all of a sudden you get hives, and it's this kind of more immediate inflammatory, more like allergic reaction, and then it goes away. So it's a little bit different. What I would have to say though is the root cause and the way we fit those puzzle pieces together and the way we evaluate is the same though. We still need to look through all those organ systems. When I think about hives, often I'm thinking about an inflammatory process, like a process where there's just a lot of histamine and inflammation happening. So we might be looking in the gut. We might also be looking in the liver gallbladder, because same thing is that funnel might be really full and it's overflowing. Okay. So that will lead me into, okay, where do I need to do testing? Where do I need to look to help this person? Okay. I've had blister type bumps all over my fingers and are very itchy and then turns into dry skin. What type is this? This is definitely 100% dyshydrotic eczema. Again, you can have multiple types of eczema sometimes paired together, but the blister type of eczema that you are describing, especially on your fingers, is the dyshydrotic eczema. And as we mentioned, in terms of a root cause for that dyshydrotic eczema, we want to think about stress. I would say that's the top of my list when I think about dyshydrotic eczema. We don't understand this fully yet from a research study perspective. But clinically, what I have seen with dyshydrotic eczema is I have seen a lot of stress response related to this, and sometimes traumas that we actually need to work through that are even from our childhood, or, sometimes we don't even know that we're stressed out. So that might be something to think about and look into. Okay. All right. If you guys have any other questions or comments, please go ahead and type into the chat or the comments box here. I'm happy to answer any and all questions. This will be recorded, and I will be posting this if you guys are just coming now and you want to go back and learn about the 7 types of eczema and how to address the root causes of each. Also, I did write a blog, so if you guys just want to read about this, all this information is in the blog as well too, and the links are in my bio, okay? All right, and someone's saying, my son's pediatrician noticed from the beginning he mostly has it on his arms and legs and comes and goes depending on the seasons when they tend to pick up. When it does, he itches profusely. Okay, so often, yes, the seasons can actually change our eczema, and the environment can change our eczema. The weather can change our eczema. But What I would have to say is it's still indicating an internal imbalance, even if it's coming and going because of external factors. We still want to think about the internal factors going on. No matter what type of eczema someone has, I still want to do my checklist of checking all of the organ systems. If you book a consultation with me, that's one of the first things we do. So we do have a free eczema assessment. That's kind of more a basic assessment to just kind of see the different possible root causes. That's one thing you guys can do. But if you do book a consultation with me, one thing I'll ask you to do is actually go through all of the organ systems and answer all of these questions so that I can understand where the dysfunction lies. Okay. And you're saying he does suffer as well, sometimes from constipation. Yes. And I'm not surprised. Almost every type of eczema is going to have a gut problem, even though as we went through the types, I didn't say gut in each and every section. And that's why I kind of started this talk and I'm ending this talk with it's a lot more complex than I broke it down today. But with how I broke it down, those are kind of the specific things to look at. So gut is almost always implicated in every type of eczema. So we want to think for constipation, again, we want to think about diet. We want to think about microbiome health. We want to think about leaky gut. We want to think about all of that. We even want to think about liver gallbladder. And I think sometimes we don't realize that there's an association with the liver gallbladder and the gut. All right. If you guys have any other questions or comments, please go ahead and type into the chat box now. Just as a reminder, we are doing a clean food challenge this week, and it's really easy. You guys don't have to post every day. You actually only have to post one time this week until Sunday. And then just tag me at drfong.nd and then use the hashtag clean food challenge or eat to heal eczema. And if you post a clean food picture, that means that it is a colorful plate with lots of vegetables and fruits. You have a good protein on there. And then 3 things I do want you to remove would be gluten, dairy, and sugar. And then I also want you to eat whole foods. So I don't want you to be posting a picture of a packaged item. And if you just post once this week and only once, it doesn't need to be every day, you tag me and then use those hashtags, you will get my free eczema relief jumpstart guide for free. And this is a $47 value. This really kind of breaks down all the different sections that you can start doing to really help jumpstart your healing process. And then 2 lucky participants will receive my Clean Skin Topical Kit. I've talked about the things in the topical kit today, like my Clean Skin Calm spray, my Clean Skin Restore probiotic spray for the skin, and then my Clean Skin Protect, which is for that barrier. And that person, 2 people will also win a root cause consultation with me. So we can dive deeper. You'll get that, that assessment to go through all of your organ systems. Okay. So join me this week. It's super easy. All you have to do is post those pictures once. And if you're private and I might not see it, then you just want to just send a snapshot of it and send it over to me. Okay. All right. And then lastly, if you haven't done my eczema root cause assessment yet, and you are here and you are interested in learning about eczema, I would definitely start there. Just take my assessment. It will break down the different root causes for you. I've talked about some of those today, like microbiome imbalance, leaky gut, leaky skin. Those questions are all on this assessment. It's free. It's easy. It only takes 3 minutes. If you want to dive a little bit deeper, you can also go to my eczema relief workshop. This is happening next Tuesday at 6:30 p.m. So check that out. The link is in my bio. And finally, if you are ready to book a one-on-one consultation and you do want to meet me, we're giving 30% off for you attending this live, and it's IGDC30 is the code, and there is a money back guarantee on my consultation. So if you go to that consultation, you don't feel like you learned a lot and you really understood at the end what the root causes might be for you, just ask for your money back. We're happy to give you your money back. Okay. So if you have any other questions, please go ahead and type into the chat or comments box. Otherwise, thank you so much for joining me today. If you want to learn more about this topic, Definitely check out my blog. The link is in my bio. DM me if you have any questions after this as well. And I hope to see you guys next week on my live next Wednesday. All right.